Hello, welcome back to another video that I am doing right now. I'm Art, and I try to handle depression in a very certain way. Now, you might notice something different about me this time. I'm wearing a mask. Now, here's the question: why am I wearing a mask? Hopefully, you can hear me very well through this. It's a nice, cool-looking mask, of course, but it's a mask nonetheless. What happens is a lot of people who deal with depression, anxiety, bipolarism, or any kind of mental illness, a lot of us, we wear a mask to hide the symptoms because of stigmatism. What's stigmatism? Good question. Let's see. Good phone. Or stigma. According to stigma, it's a mark of disgrace associated with a particular circumstances, quality, or person. So, in other words, one of the good examples is a stigma mental disorder. Usually, it's used for like religious purposes, but of course, let's look at it another way. A mark of disgrace or infamy, a stain or reproach as in one's reputation. A mental or physical mark that is characteristic of a defect or disease. Don't know how well you can see that, but basically that's what kind of stigma is. And what happens is a lot of us who deal with this, we're assumed that we're weak-minded people. We're very weak-minded. The problem is that we're not weak-minded. It's that sometimes things that happen beyond our control and we cannot function. Mental illness sometimes will cripple someone to where they were actually doing very well in everything they do, and then all of a sudden they can't function anymore. Hmm. Hmm. Now, how does this fit in with what's going on? Sorry. How does this fit in? Well, here's the thing. Mental illness, no matter what kind of mental illness it is that we we look at it as people. You look at it as people are weak, like they can't handle or they can't function. You get things like, "Oh, you're weak." Are we really weak, or is that something that happens that's beyond our control? I mean, here's a question: to some people, being pregnant is like an affliction. It's a good affliction, depending on how you look at it. But here's the situation: is anybody going to say, "Oh boy, you are very bad for having a pregnancy"? Sometimes, yes, depending on the circumstances. But one of the things that we got to look at is that mental illness is a disease. It's a very big disease, and nowadays it's kind of hard to determine because some people it happens and some people it don't. Like I said before in another video, sometimes it's acute. It happens suddenly, and then after that, it goes away. And in some people, it's persistent. Hmm. Which means that they follow them wherever they go. It's a sad thing, really. Very sad thing. But mental illness kind of doesn't really define who we really are or what we're all about. It's just a certain state of thing. Now, what happens is whenever you deal with someone deal with depression, you gotta realize a lot of them sometimes will wear a mask, like how I am. And the thing is that we, while be wearing this mask, we'll act as normal as anybody else. And then as soon as everything dies down and we're by ourselves, that's when we fall apart. Or that's when we let it hit us. That's what we call it, and that's what some people call the functioning side. If it doesn't let you, if it still lets you, if you can still function and still do all this, then that's good. If you can't, then that's a different story. Mm-hmm. And sometimes, as you can see, why me wearing this mask, it's nice, but it's slightly uncomfortable. Slightly uncomfortable. But I'm wearing this to illustrate an ideal, a concept that happens a lot, especially with me. A lot of times I'll put on my mask, especially if I know I have to go around people, especially if I go to work. I had to put on a mask and act like nothing's going on. Nothing. Like I'm invincible. I put it in the fake bravado. I'll laugh. I'll make the stupid jokes. And even though you don't know if I'm smiling or not, I'm still wearing a mask. See, I could be smiling right now, and the only way you could tell is if you see any kind of any kind of facial reflection in my eyes, or if you notice my cheekbones moving up and down like this. I could be growling, snarling, or I could be happy and smiling. Sometimes you can't tell, but you, but that's what the reason for the mask. And it's cutting off my circulation from my eyelids and stuff. See, you can't tell, can you? Mm-hmm. But anyway, I love this mask. I loved it. When I first saw it, I said, ooh, I gotta have it, and I got it for a good price. Not telling you where I got it. That's not what this video is about. I might make another video to tell you all the cool stuff I bought. Who knows? But this video is not for that. And a lot of times, when after everything's said and done, that's when the breakdown happens. And when the breakdown happens, that's where it's people will look at you and like, are you okay? You don't worry, you'll get better. And the funny thing is that true, a lot of us will get better in time, with time, medication, or even therapy, or just someone just to listen to them. That's what a lot of people need the most, someone to listen. But they're not to listen in a kind of like, oh bro, I have a problem kind of listening. But you have to actively listen. I'll give you an example. Years ago, a friend of mine came to me with a small, well, it's actually a big problem. At first, when I listened to that person, I was looking at what my viewpoint of that person was, what my viewpoint should be. But in reality, I didn't know the whole story. I only know what they were saying to me. And I was thinking, oh, don't worry. Don't worry. You stick with the situation. It'll get better, Try to work it out. Try to do something. Try to do something. But the funny thing is that when that person came to me, if that person would have came to me with this a couple months earlier, totally different conversation. But I'm thinking this is an acute, something just happened just like that, but it actually something was going on and on and on. And so I gave that person my advice. I said, well, maybe you should stick with that situation. But see, things I didn't know because that person didn't open up to me about that. Then also when it starts getting, then within a year or so later, it starts the situation started getting worse. And I had a totally different eyesight because I knew what was going on before. And I said, "Ooh, you know what? Maybe it's the best thing for you. Maybe making a change is the best thing for you." And the thing is, if I had actually listened to before, I could have even said the same thing before. Either I could have jumped the gun and said, change this situation. You got to change it. Or I could say, try to stick it out. Maybe it might work. And the thing is that a lot of times we do that. A lot of times. A lot of times we'll stick with a situation, especially like mental illness. With mental illness, a lot of times we'll stick with a situation that we know is not good for us, even though we should just give it up. And sometimes that happens. Because sometimes we have to learn our lessons. But the thing is that the idea is that we're around other people, we wear this mask. To a lot of people, we wear this mask. But the problem is that a lot of times, in order to get better, we have to take off the mask. A lot of times we have to take off the mask and live. That's what I'm trying to do. I'm trying to take off this mask and live. Like I said, I love this mask. But the thing is that this mask right here hid a certain portion of what I was. And that's what a lot of us do. We hide a portion because we don't want the bad things to happen. And we have to take off the mask. Because the thing is that if you can live your life like this on life's terms, or you can put the mask on and just live like this, and hopefully you might survive. But in actuality, living like this with the mask on, you're slowly dying a slow death. And I'm not saying this to be mean or cruel, but that's what it is. It's a slow death because you're losing a sense of yourself by hiding behind this mask. Like they say, you got to be open in plain sight. So, the thing is that I'm trying to learn to be in plain sight. I'm trying to learn how to be more honest. Trying to be more honest is the operative word. Sometimes it doesn't work, but a lot of times it does. And believe me, there's a lot of times people will tell me, "No, if you need anything, just give me a call." And there's a lot of times I know that. And thing is, I'm pretty sure things in your life, you know that too. But a lot of times we're afraid to pick up that. A lot of times we're afraid to pick up that phone because we're still wearing this. So sometimes you have to put this down and pick this up. Ooh, my reflection in a reflection. That don't sound right, but you get the gist of it. With that, I'm going to close up for today and enjoy the rest of today. Laundry day. So it's a lot to do and a lot to deal with. So hopefully this might help somebody, and talk to you later.